Prescriptive Authority to Advanced Practice RNs by Priscilla Williams, RN, BSN, Nursing 550. What does prescriptive authority really mean? Also called independent practice, it is the ability of the advanced practice nurse to prescribe without limitation prescription and controlled drugs, devices, medical services, and other equipment and supplies. It does not require collaboration with the physician, and it is the key element of the advanced practice nurse's scope of practice, as well as being part of the consensus model. Just to review so we can compare, what was the old Colorado law? The old Colorado law stated that advanced practice registered nurses needed to be monitored by a physician before they could obtain prescriptive authority and complete 3,600 contact hours. That would have been 1,800 hours of preceptorship while in school and 1,800 hours of mentorship postgraduate by a licensed physician only. This is a list put together by the authors Meyer in 2013. They actually broke all the states in the United States into 3 categories. The first categories were states with full practice authority. The second is states with restricted practice authority. And there is another list that Colorado was on with reduced practice authority. Now that this bill has came into effect, we should be part of the states with the full practice authority. The negative effects of the old bill. For the healthcare system, there is an increased shortage of providers in the state of Colorado. Patients have limited access to care, and they also have delay of care. For advanced practice nurses, the negative effect was many advanced practice nurses were leaving the state of Colorado to practice in nearby states. Those that didn't do that had a hard time finding employment, and a lot of times they had to start off at a lower pay rate because they didn't have that prescriptive authority. The solution. The solution was passing Publication Bill 15-197. This bill is not just important for nurses, but is also important for all Coloradans that experience difficulty with access of care. This would include our Colorado veterans, women's care, and behavioral health, just to name a few. What is Bill 15-197? Basically, the bill is made up of 3 components. The first component was the provision of prescriptive authority upon the completion of your advanced practice nurse registration. The second component was the reduction of hours from 3,600 hours to 1,000 hours and a 3-year work experience requirement to do this. The last part of the bill was to allow experienced, licensed, advanced practice nurses or physicians to mentor new graduates to the transition to full prescriptive authority. And this is a big key because before, the old law stated you can only be mentored by a physician, a licensed physician only, not another advanced practice nurse. A lot of organizations supported the bill. Just to name a few, the Institute of Medicine, National Governor Association, and the Federal Trade Commission. Many organizations like these would like to see the nurses with advanced practice to be able to practice to the full extent of their education and training to improve both access to care and quality cost effectiveness. When we talk about full scope of practice, you see that in a lot of literature. What exactly does that mean? The most recent definition given by the American Nurses Association in 2010 states the scope of practice for advanced practice registered nurses is the protection, promotion, and optimization of health and abilities, prevention of illness and injuries, alleviation of suffering through diagnosis and treatment of human response, and advocacy and care of individuals, families, communities, and populations. The next step is implementation of the bill, and the effective date for this bill is September the 1st, 2015. Now that the bill is passed, there is still work to do. Implementation of this bill is just as critical as the bill itself. The steps to the implementation will first be an emergency rule adaptation. This emergency rule implementation will be implemented July the 21st, 2015. This is to cover advanced practice nurses currently in school and those currently fulfilling their mentorship requirements. The process of implementation is being done by DORA. DORA is asking to hear everybody in the public, stakeholders, their concerns, their ideas, and their comments on how this bill should be implemented. Although they have the final say, they are open for suggestions. This is our opportunity as advanced practice nurses to put a stamp on how we want this bill to be activated in Colorado. What have I done? I have participated in a webinar for stakeholders on the DORA website on June the 16th, 2015. I also submitted a letter of my concern on how I feel the bill should be implemented. I also did that on June the 16th, 2015. When I wrote the letter, my main concern is that the bill be very concise in its wording of the definition of a mentor. Under the new law, the mentor does not have to be a licensed doctor. Any provider with prescriptive authority will be able to mentor an advanced practice nurse in order for them to get prescriptive authority. There is no evidence that shows any benefits of having a mentor as a licensed physician versus a mentor as an advanced practice nurse. So this is really important to me, and if these are your concerns, it's important that you get your voice heard as well. Review of the webinar. The main things that were discussed on the webinar, the most important concerns that many people had was removing the preceptorship and the preceptor requirements. So we talked about that. And they also talked about what constitutes clinical work experience. And this spiked a lot of attention. There were doctor groups represented here, and they made their voice known that they wanted to make sure that the clinical work experience was not educational experience. For example, if you had a registered nurse that graduated with her BSN, she did not work as an RN, she went straight through to a graduate program, she could not get prescriptive authority in their idea because she would have to work 3 years first as an RN, even though she went through all that schooling before she could get her prescriptive authority. And myself and others voiced the opinion that your clinical experience should count as work experience so that that nurse who went from her BSN to her graduate studies should be a smooth transition still right into the public and being able to prescribe. So if this is something that you feel strongly about, you need to get your opinion heard. I did do some research on whether it's a difference if a registered nurse that has 3 years work experience versus a registered nurse that goes straight to her graduate studies and has her prescriptive authority. And evidence shows that they are still as safe as a nurse that did either one. I also found some articles that said this would affect recruitment, because if you tell young nurses or potential nurses that they could go through their graduate study, but after they graduated, they would have to wait 3 years before they could prescribe, most people wouldn't do it. The last big subject that was talked about was updating the clarification of mentorship requirement. And that's another thing I feel very strongly about, that when DORA implements this bill, they make sure the wording is very clear that a mentor is anyone, any provider that already has prescriptive authority. What can you do? you can use your voice and you can attend meetings. The next meeting is going to be July the 21st, but this is a State Board of Nursing emergency rule adaptation. So you can go on the DOR's website and see how they made the ruling on this. You won't actually be able to speak and get your voice heard. The next meeting that you can attend via in-person or WebEx will be August the 5th, 2015 from 9 to 11. This is where you can get your words across, your comments across, and how you feel this bill should be implemented. The last meeting will be announced at a later date, and this will be the State Board of Nursing ruling and hearing for the permanent rule. There is also, you can write your comment via email, and Dora is excited for people to do this as well. The last day to get your written comments in is Monday, June the 22nd by the end of business day. Thank you for your time. I hope that you feel passionate about this and you will get your voice heard as well.